The Black Death, known as the Plague, killed 75 to 200 million people between 1346 and 1353 in Europe. This disease is thought to have originated in Central Asia along the Silk Road. As merchant ships began to travel from Asia to Europe as well as the Mediterranean, they carried oriental rat fleas on the black rats. Now, this is thought to have caused it to spread to Europe as well as other countries, killing 30 to 60% of Europe's total population. Now, the plague is caused by bacterium, Yersenia pestis. This can be manifested in three ways: bubonic, which affects the lymph nodes; septic, which affects the bloodstream; and pneumonic, the most lethal, manifests within the lungs. Now, some of the typical symptoms occur are tumors within the armpit or groin, acute vomiting, and fever. Now, rats are the most common host. This is a zoonotic disease which is transmitted to humans via flea bites. So this is going to be common in an overcrowded area or an area where there's a lot of people. There are two treatment methods for the plague. The first is streptomycin. It's a member of the aminoglycoside class. However, it is expensive and hard to get a hold of. The preferred treatment method is doxycycline. It's also used for those who do have sensitivity to aminoglycosides. The mechanism of action inhibits protein synthesis at the 30S ribosomal subunit. This drug is effective, cheap, and readily available. Doxycycline has a high degree of lipid solubility. It's stable in human serum, and it has a low affinity for calcium binding. Silicone particles can be used with doxycycline as a drug carrier. The purpose of nanoparticles are to coat the drug around a silicone base in this case. Now, this allows the drug to target a specific area in the body, leads to increased time in the body, increased absorption rate in the body, and the range of these nanoparticles range between 1 to 100 nanometers. Nanoparticles have been used in conjunction with tetracycline for combination drug therapy. In a case study against Salmonella, tetracycline was bound to a silver nanoparticle and used in combo therapy with penicillin to treat Salmonella. Now, the penicillin alone had no growth inhibition. The use of both the penicillin in conjunction with the tetracycline nanoparticle exhibited effective inhibition growth against Salmonella. This is most likely due to the degree of advanced bacteriostatic binding.